Hello, this is HIPAA privacy training for the New York State Department of Health. In this training, you will learn what you need to do to protect confidential medical records and insurance claims records, which are called protected health information under HIPAA. Please note that the word HIPAA is spelled with just one P and with two A's.
HIPAA is a nickname for a federal law called the Health Insurance Portability and Accountability Act of 1996. The portability rules allow you to keep health insurance coverage when you change jobs, even if you have a pre-existing condition. But this training is not about that. HIPAA also standardized the way that health care providers use computers to send information about patients to health insurance companies in order to get paid for the care they provide to patients. This training is not about that either. This training is about the HIPAA privacy rules, which can be found in Parts 160 and 164 of Title 45 of the Code of Federal Regulations.
HIPAA uses the term health plans to refer to private insurance companies as well as government health insurance programs, such as the New York State Medicaid program. Now that healthcare providers and health plans are sending so much health information through computers, the federal government created rules to protect the privacy and security of the information. This training is mainly about the privacy rules. Everyone who works for the New York State Department of Health is also required to complete another training that just deals with security.
There are a lot of laws and rules about privacy, but the HIPAA rules apply to healthcare providers and health plans. At the New York State Department of Health, the HIPAA-covered programs are the hospital and nursing homes operated by Health Facilities Management and the health plans run by the Office of Health Insurance Programs, including the Medicaid program, Child Health Plus, and EPIC, the Elderly Pharmaceutical Insurance Coverage Program.
Everyone who has gone to the doctor has been asked to sign a piece of paper stating that they have received a HIPAA Notice of Privacy Practices. This is simply a statement of how the doctor may use and disclose your protected health information. Any patient at a healthcare facility operated by the New York State Department of Health gets a Notice of Privacy Practices. A Medicaid beneficiary or other enrollee in any of the department's health insurance programs is also informed how to get a copy of the Notice of Privacy Practices of the health plan. All of the department's notices of privacy practices are posted on our website.
Any health information that could identify a particular individual is protected health information. For example, the fact that a patient has a particular diagnosis or received a particular treatment or is enrolled in a particular health insurance program is protected health information. Even if the information does not contain the individual's name, if it contains other identifying information, such as a date of birth or a date of admission to a specific hospital, it is still protected health information under HIPAA.
The reason you are taking this training is that you may need to use or disclose protected health information in order to do your job. The HIPAA rules allow you to use and disclose protected health information for the purpose of treatment, payment, or healthcare operations, which is just another way of saying that you are allowed to use and disclose protected health information as needed to do your job. But HIPAA prohibits you from using or disclosing protected health information for any other purpose, unless you have a written, signed authorization from the individual whose information you are using or disclosing. For example, you are not allowed to access information about people you know personally if it's not something you are doing as part of your normal job responsibilities.
You are only allowed to use and disclose the minimum necessary amount of protected health information to do your job. This is just another way of saying that you should only use and disclose protected health information on a need-to-know basis. For example, You may be able to access the entire Medicaid information system, but you are only allowed to access the system as needed to do your job. Do not disclose protected health information in places where people who do not need the information can overhear you, such as in an elevator.
When you are disclosing protected health information to do your job, you need to make sure that the person you are disclosing information to really is authorized to receive the protected health information. Before disclosing information to a person you have not dealt with before, you need to verify the individual's identity. Verification usually involves asking the people to give you information that they would not have unless they really were who they claimed to be.
If you learn that someone in a HIPAA-covered program in the Department of Health has disclosed protected health information to a person not authorized to receive it, you need to tell your supervisor. In these cases, the department may have to notify the individuals of the breach or unauthorized disclosure. Do not include protected health information in emails or faxes unless you have to, and if you do have to, be very careful to send the information to the correct email address or fax number. When protected health information is in a fax, you need to make sure the intended recipient takes the fax out of the machine on the other end, so it's not just left there where other people could see it.
HIPAA gives individuals a number of specific rights, which are spelled out in the Notice of Privacy Practices. For example, patients and health plan enrollees have a right to access their own medical records and billing records.
Individuals can also request that information be sent to a mailing address that is different from their home address. This makes it possible to get treatment without other members of the household finding out about it.
HIPAA also gives people the right to request an amendment to their health information. A HIPAA-covered program is not required to make the amendment if the information is believed to be accurate, but individuals requesting an amendment are entitled to add to the record a statement indicating why they believe the record should be amended.
HIPAA requires all members of the workforce to get HIPAA training. The Department of Health is complying with this requirement by providing this training to you. In addition, your supervisor will give you information about ways that HIPAA applies to your particular job here at the department.
In addition to this privacy training, you are also required to take another training on security. To maintain the security of protected health information, don't save protected health information onto a laptop, flash drive, or other portable electronic media unless you have to. And if you do have to, make sure the device is encrypted. Just because your laptop's operating system prompts you to enter a password, that does not mean that your laptop is encrypted. Speak with your supervisor and IT support to make sure your laptop is encrypted, not merely password protected. Do not write your password down or give it to other people. Other common sense security measures include locking your computer when you leave your workstation, not leaving protected health information out in an unlocked office, and not recording protected health information when you leave a voicemail message. You should not put protected health information in the trash or recycle bin. Instead, you should make sure it is shredded.
Patients at Department of Health facilities and enrollees in the department's health insurance programs have a right to complain that the Department of Health is not following the HIPAA rules. Report any such complaints to your supervisor so the complaints can be investigated and handled properly. Complaints that a health care provider or health plan other than the New York State Department of Health is not following HIPAA should be directed to the federal government, since HIPAA is a federal law, not a state law enforced by the New York State Department of Health.
The Department of Health has contracts with many different contractors. The contractor is a HIPAA business associate when the contractor is creating, receiving, maintaining, or transmitting protected health information on behalf of the department. These contracts include the department's Appendix H for HIPAA, Business Associate. Appendix H requires the contractor to protect health information in the same manner that the department protects it.
HIPAA is a federal law. If you accidentally break the HIPAA rules, you can be punished, the same as if you broke other rules of the workplace. If you purposely break the HIPAA rules, you could face criminal prosecution. The most important thing to remember is that you should only use or disclose health information as needed to do your job. If you're not sure, just ask your supervisor.
Thank you for taking this HIPAA training.